Hello, and welcome to Hawaii Literacy's Adult Literacy YouTube channel. Today we will be talking about health literacy and specifically COVID-19. So, what is health literacy? Health literacy is the ability to read, understand, and make informed decisions when it comes to your health. What is COVID-19? COVID-19 or coronavirus is a virus, and a virus is made up of germs that make people sick. One of the most common viruses is the common cold. COVID-19 is a new virus, so we are still in the process of learning about it. So how do I get COVID-19? So COVID-19 can be spread from person to person in the air through coughing and sneezing. Achoo! The virus can also spread from touching an object or surface that has the virus on it. The virus spreads very easily. What are some of the symptoms of COVID-19? If you find yourself experiencing a fever, coughing, hard time breathing, chills, muscle pain, loss of smell or taste, these might be signs that you have COVID-19. But just because you have some of these symptoms doesn't mean you have COVID-19. There's lots of other viruses that have similar symptoms, like the cold and the flu. So, do I call a doctor or... Well, the only times that you should call a doctor is if you are experiencing trouble breathing, a high fever, and your lips or face are turning blue. You should definitely call your doctor. But for most people, they'll only experience mild symptoms and be able to recover at home. So who is most likely to get COVID-19? The good news is that most people who get the virus will get a mild case and recover quickly. It's also a small number of people that will get the virus that end up getting really sick and might even die. Older adults, people with breathing issues, and overweight people are at higher risk of getting the virus. In fact, many people who have the virus are asymptomatic. It means they show no signs or symptoms of the virus. But just because you don't feel sick doesn't mean you can't spread the virus. That's why it's important for all of us to stay healthy and do our part. So how do I stay healthy? Well, there's plenty of ways that you can help slow the spread. Staying at home when you're sick, avoiding contact with people who are sick, getting good rest, eating healthy meals, drinking plenty of water, washing your hands for 20 seconds with soap and water multiple times throughout the day. And if you don't have access to soap and water, using hand sanitizer. You want to avoid touching your eyes, your nose, and your mouth. And if you have to cough or sneeze, sneeze into your elbow. You want to wear a mask when you're going out in public, doing things like grocery shopping, or just the store in general. At home and in the office, you'll want to clean and disinfect high-touch surfaces. That's things like doorknobs, countertops, light switches. You also want to practice social distancing, or standing 6 feet apart from other people. Finally, if you've traveled recently or been in contact with someone who is sick, it's best to self-quarantine or stay at home for at least 2 weeks and minimize your exposure to other people. So now that I understand the virus, is there a cure? Unfortunately, there's no cure to date. Doctors are working, though, on creating a vaccine to treat the disease. So in the meantime, if you can stay home, practice social distancing, wear your mask, and wash your hands, you're doing your part to stop the spread of the virus. Thank you guys for listening to our first installment of health literacy here at Hawaii Literacy. If you have any more questions about the virus, please visit the Center for Disease Control and Prevention. The website is listed on this slide. Or if you have questions in general about literacy, please feel free to call Hawaii Literacy. Thank you.